Guo Xiu, what did the experts say about their investigation?
So yeah, the press conference is still going on, but I got something new here. We know that 25 experts from the international community in China began work from February the 16th, which is over the last week. They have completed their all work. They went to Beijing, Guangdong, Sichuan province, and Wuhan, the epicenter. And they just come back from there, I think, today. They talked with the officials, frontline medical workers, and the public. According to Professor Liang Wannian, which is who is head of the expert panel on the COVID-19 response of the China National Health Commission, there are some major findings. First, about the knowledge of the virus, there is no significant mutation of the virus, and average age of infected patients are 51, and it could be infective to people of all ages, but 80% of them are aged between 30 and 69, and 78% of the cases were from Hubei province. And that's the figure by February 22nd. And the virus animal host is not fully confirmed yet. The major transmission ways are through the respiratory system and contacts. There are a possibility of aerosol transmission in closed space. And most of the cases in Guangdong and Sichuan province are from families, about 78 to 85%. Also, we know that over 3,000 medical staff were infected, but how many were infected through community infection and how many through hospital care actions need to be further confirmed. We also hear a report from Dr. Bruce Aylward, who is Senior Advisor of the Director General of the WHO. He says their report has 45 pages, but 8 major points, and half of them are related to China. He says, facing the previously unknown disease, China made most ambitious and aggressive efforts. China did something rare for other places in the world, but the tremendous collective will is something he want to stress here. We can take a listen.
But what we found was, even though every province was suffering outbreaks and was getting infected, the governors were prioritizing the movement of medical teams and PPE out to Hubei and Wuhan. And that's a very important message for the rest of the world about how we work in the kind of solidarity and collaborative action that's going to be needed to beat this virus. And it's the opinion of the Joint Mission, after looking at this very, very closely and in different ways, that there's no question that China's bold approach to the rapid spread of this new respiratory pathogen has changed the course of what was a rapidly escalating and continues to be deadly epidemic.
Well, by that, he confirmed the drop of the new confirmed cases in China, and he says China's efforts have changed the development of the epidemic, and those efforts have reduced at least 10,000 or tens of thousands possible infected cases. He confirmed the drop of cases in China, but as economy and life are bringing back to normal gradually, he says control measures need to be canceled gradually. And also, he says the risk from China is dropping, but China's experience in this is valuable to the world. He says there is still time for the world to get better prepared. They made recommendations to the world, to about over 20 of them, but he wants to stress one point, is that all the measures need the public's collective will to contribute and to make it successful. And that's what China did too. Back to you, Zoe.
Yes, indeed. Thank you very much, Guo Xiu.